This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations.
Start by washing your hands thoroughly with soap and water. Remember also to wash your thumbs. A hand sanitizer can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need ready before you start to catheterize. You will need a catheter set, sterile wipes or soap with a neutral pH value and water, and perhaps a mirror which can be fastened onto your thigh. Pull your clothes down so you can move freely when doing the catheterization. Push yourself forward in the chair so you can spread your legs to allow for easy access to the urethra. If necessary, hold your legs apart with a device developed for that purpose. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must first clean the area around the urethra properly. This might be easier for you if you fasten a mirror onto your thigh. Spread the labia apart and wash the opening to the urethra. Wash from front to back in order not to transfer any bacteria and cause an infection. Use each wipe only once. Twist to open the tube and remove the lid. Unfold the bag. Twist and pull the catheter out of the tubing. Now it is ready to insert. Make sure that the catheter does not touch anything before you enter it into the urethra. If it does, you must use a new catheter. Touching the sink or your clothes or skin, for example, will contaminate the catheter and can potentially cause infection. To make insertion of the catheter as easy as possible, it is important that you relax. Slowly and gently insert the catheter into your urethra. Make sure you use gentle movements. Continue to insert the catheter until it reaches your bladder and the urine starts to flow. Then insert the catheter about 1 inch further and hold it there until the urine stops. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. Put the catheter back into the tube and reseal it by twisting the catheter clockwise. Open the urine bag by tearing off the tab and empty it into the toilet. Twist the bag around the tubing and replace the lid. You can dispose of the catheter set in your household trash. Do not flush it down the toilet. Wash your hands and you have completed the process. Important note: the catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film are only intended as follow-up to the advice you have already been given.